Mental health patients who call an ambulance are increasingly being thrown in the back of a divvy van. The police union says a lack of paramedics on the road means the police are often left to pick up the shortfall.
If you call 000 for an ambulance, you'd expect paramedics to turn up, but some patients have been getting police instead.
They are so desperate that they're using Victoria Police resources that are already stretched.
Police Association Secretary Wayne Gatt vented his frustration this morning on radio, claiming officers were increasingly being called to deal with mental health jobs because ambulances were not available.
We'll have to make a risk assessment to, is it better to wait here, or is it better to just put them in the back of a divisional van and transport them to the hospital?
A spokesperson for Ambulance Victoria said, "There are times when both police and ambulances are dispatched to cases that require both agencies. At times, paramedics will arrive first and wait for police, and sometimes police will arrive first." The Mental Health Royal Commission recommended health always be the first response, not police.
We're well underway in terms of doing that important work, but that's not a switch that you just flick.
It was an issue that dominated question time in Parliament following last week's release of a report into the state's struggling 000 agency.
What more evidence is required for the Premier to finally admit that the ambulance system is in crisis?
Every budget, every year, more resources for Ambulance Victoria.
After another code orange for ambulances was declared overnight, and with an average of 2 or 3 a week now, it's unlikely to get better in the short term. Patrick Murrell for 10 News First.